My name is Miriam Janssen. I'm a health scientist and I work at the Department of Social Medicine, and I'm the coordinator of the clerkship Family Medicine and Social Medicine.
My name is Marion van Lierop. I'm a medical doctor working at the Family Medicine Department at Maastricht University, and I'm together with Miriam the coordinator of the clerkship in Family Medicine and Social Medicine.
We use this form of PBL in the clerkship of Family Medicine and Social Medicine, which is part of the 5th year Master of Medicine in Maastricht. And it's during the work placements of the medical students as well as during faculty days, the returning faculty days.
We developed this course because we wanted to achieve that our medical students learn about interprofessional collaboration. And as we know, interprofessional collaboration is a prerequisite to enhance healthcare and patient-centered care. And that's why we thought of this activity to enable students to learn how to work together with other health professionals.
Now, the medical student selects a frail elderly patient in his family medicine placement, pays the patient a home visit, takes the patient's history and elaborates on the personal goals of the patient. Then he develops a provisional care plan for that patient, sends the care plan to the students of Zuyd University of Applied Sciences, and the paramedical students and nursing students of Zuyd University elaborate on those care plans, prepare those interprofessional team meetings, which are planned on the faculty days, the returning days at the university here in Maastricht. And then together they discuss the patient and develop the final care plan.
We ask our medical students to make use of the International Classification of Functioning and Diseases, and is especially useful for health professionals to work together in order that they use the same language when it concerns diseases or functioning of patients. We are most proud of the fact that we managed to make use of real-life cases, authentic patients at the workplace family medicine. And we found it important that medical students were able to be part of the healthcare team in this way.
Now, the biggest challenge was to organize this interprofessional team meetings, because every school has its own schedule for his students, and luckily all staff members of Maastricht University who were involved, and also the members of Zuyd University, were very enthusiastic in organizing this instructional activity. And therefore we achieved this activity for 360 medical students as well as 360 paramedical and nursing students.
I think it's constructive because in the simulated team meetings they elaborate on what they have learned, they activate prior knowledge, and by focusing on their cases, they trigger deep learning. I think it's collaborative because they work together. It's a form of interactive learning in an interprofessional collaboration. They try to solve together a case in this meeting, and they learn with, from, and about each other's professions, so they get a view of the perspective of other health professionals.
It's also contextual because students select their own cases So those are authentic real-life cases instead of paper-based cases. They are professionally relevant to the students. It's also self-directed learning. Students are enthusiastic about their learning and are motivated to regulate their own learning. And they have an option to choose their own frail elderly patient.